Okay, so we'll just get started. So welcome to COVID-19 online summit for resources and action. Our goal with the summit is to inspire community leadership and to bridge gaps between services, and also to provide information and knowledge, right? Along with what's happening. There's so much information out here, misdirected information, or just so many theories and opinions that sometimes it can be confusing and hard to know what's true, what's scientifically backed. So with the summit, we'll be inviting different guests on to discuss different topics. And today I am the co-host. There'll be different co-hosts, I can't even talk, co-hosts of the summit resources and taping. And today we have Dr. Jasmine Zapata on. She's a dynamic person. What do I say about you, doctor? Like, you're author, you're community activist, you're community spokesperson, your mom full-time, you just had a baby, so let's talk about that too. You're just all around inspiring. I know you do a lot of Black girl conferences around the United States. It might be the world. You might have left the country knowing you. But thank you today for joining us, providing us with the perspective of science, doctor, by your expertise. So this conversation is not structured to go anywhere specifically, just to have a genuine engagement and allow us to have a good discourse about it. So I guess my first question for you is, how are you doing, right? Like, how are you doing as a doctor, working in a hospital, managing your family, making sure they're protected? How are you doing, doctor?
Thank you for even asking that question. That's so meaningful. And I'm doing okay. I do have my ups and downs. Last week it was really hard on me. I did have a little breakdown where I just it was hard for me to breathe even one night, just continuing to read these stories of my fellow doctors writing their will, starting to write their wills, them losing it mentally. Just hearing their stories was really, really heavy on me. And then my own kids being scared of different things. But this week is honestly much better. I'm practicing self-care. We had a big family pillow fight Sunday night, and that just made my whole week. So I relieved some stress in a family pillow fight, and I'm doing good. So I really appreciate you asking me that.
That's so good to hear. I mean, and that's the catch, is like how to be intentional about self-care and taking care of ourselves and creating moments of happiness and joy with the people around us. It can be really challenging during this time. Folks are high on anxiety. There's so much uncertainty. And like you said, doctors are writing their wills. You know what I mean? Like you guys and the nurses and all healthcare workers are our first line of defense. And I can't even imagine. I can't even imagine. So what are some things that like happening in the hospital as a result of this that's different than the hospital, your experience as a doctor working in a hospital 60 days ago?
Yes, there's a lot of silent fear, I would say. And it's not that people are panicking, but you can tell there's this kind of fear and low-lying sense of doom and gloom kind of in the atmosphere. Not as much joking around or things. People are literally like scared, because when you come to the hospital and if you're exposed, you could bring it back to your family. If you're caring for older loved ones or you have kids, like I know you said, Brandi, you have asthma. My daughter was a 25-weeker preemie that survived, but she has issues with her lungs too. So it's very, very scary. Just knowing, I think I would compare it to like if you were going into the military and it's the night before you get called in to get deployed. That's, I'm not in the military, but this is something similar, what they might be experiencing, where it's like a grave feeling, but you know you're there on a mission to fight, but you're just like, oh man, like my life could be at stake. Now, I didn't sign up for, I love my military members, but I didn't sign up for no army. I didn't sign up to be a police where my life is at risk. I signed up, I knew being a doctor, it's going to be long nights, I'm going to be stressed out. But I didn't sign up for nothing life-threatening, because when I signed up to be a doctor, I signed up that I would have protection. Like when we go into something where there's an infectious disease or some issues, I'm gonna have the proper gloves. I'm gonna have the proper mask to protect myself. I didn't sign up to go into something where it's nurses out there putting on plastic bags to cover themselves, or some people don't even have the mask to protect themselves. So it's just a little scary because people say like this is what you signed up for, but actually is not what we signed up for. No.
Oh my goodness.
But you don't want to abandon your post. You don't want to abandon patients. There's doctors and nurses quitting, literally walking off the job because they're like, I'm not about to be exposed and not protected. But then when you walk off like that, you're leaving, imagine those patients you're leaving behind. So it's like a hard ethical position to be in.
Oh my goodness. You know what's so crazy? I never even thought about that.
Yeah.
I never even considered that this would cause doctors and nurses to leave, but it makes total sense. And because we're outside of healthcare and the work of healthcare, we're detached from it. So the truth and reality of what you guys, like you said, like you didn't sign up to be on the battlefield, right? Like you didn't sign up to go to war and to be a medic during wartime, understanding that every day your life is on the line. That's not what you signed up for.
Right. It's like I put on a post before, like if you were signing up, if you were in the Army and then you had to go to a war and they didn't give you any shields or a helmet, would you you wouldn't go into that? Or even if you were a police officer right now in Madison, you wouldn't want to go into a big gunfight and they don't even have any bulletproof vests for you. You know, it's bad enough you don't have a gun because we don't have anything to fight this. So it's bad enough we don't have any like proven medications to fight it. We don't have any guns. But in addition to that, you don't even have anything to protect yourself. It would be an uproar if all of Madison police didn't have the proper, you know, things to protect themselves from a gunfight, or our military would go out. But when there's healthcare professionals that are pleading to protect themselves, then it's issues. So it's crazy.
I don't even know what to say because it's wow. Because I mean, what you said is so true. It is true. We can, like I'm speechless because I just can't even imagine what that feels like and what that looks like for you guys. And the fact of the matter, we're like, if you're sick and you got the highest sympathies, you know, the hardest, like, I don't know, hardest, that's not the appropriate medical term, but you're having really bad symptoms, right? You can't breathe. You're told to go to the hospital, to go into a battlefield in this instance, like take your infected body and put it in a hospital where doctors and nurses and hospital workers and healthcare workers are not protected. And there's no other alternative for people. And why aren't we out here raising funds or ordering the things that you guys need? That's the part that's baffling me right now. Like we're talking about the needs of the most disenfranchised people who are struggling in poverty right now, people who lost employment, people are uncertain about tomorrow. And we can't be certain about anything without y'all, right? Like the little certainty that we have is our faith in you if this terrible fate fall upon us, is to get to the hospital and be confident in your ability to be there present with us and do whatever you can do to save our lives. And how can we expect doctors to be in a mental and emotional state to be able to do that, right? When you're not feeling protected. You can't project something that you're not giving. So it's almost as if we're setting up the entire system to collapse on itself. And we're all participating in one way or another.
Yeah. What's crazy is it's a lot of reasons what's going on, like root causes. And as you know, there's always behind the scenes things that play into something. It's not just that the hospitals say, oh, we just want to be mean and not give it to you. It's a critical national shortage. So one of the things is because of everybody going out to try to protect themselves, so many people went out and bought all these masks and different things. And that actually put the hospital at a disadvantage. And then also, within administration and government, I think that our administration could be doing more to help the massive production of more of these. But there's just a lot of politics behind it.
It always is when it comes to money, ain't it? It always is a lot of politics behind it. But the crazy part about it is people do have these these things. Like there's masks out there because I just went and bought some,
Yeah.
right? Like, you know,
Yeah.
yes, what you're saying is true. And there's still other alternatives.
Right.
You know what
But
I
it's
mean?
survival though. So like
Yeah.
and people are living in a lot of fear. So right now you
Mm.
went out and bought some masks to protect yourself because you know you have asthma, you want to be protected in case something happened. But what if I came to you and I was like, Brandi, right now I have all kind of doctors in New York that are being exposed and one nurse actually died. Can you please give me every single mask that you have in your house right now, Brandi? Just think of those feelings that would come up. Would you
Yeah, I would
willingly?
probably be like, yeah, but I'm gonna keep one.
Exactly. Let me keep one. Exactly. But it's survival. What if I was like, there's 20
Yeah.
doctors right now that are seeing patients. We need every single one of them. But you just see,
Right.
I'm not trying to say
No,
do that, but
I
that's
get it.
the ethical
Yeah.
position. Everybody's trying to like, I want to help other people, but I got to help myself too. So it's
Yeah.
hard. Yeah.
Yeah. And the reason I brought up Menards is like, why aren't the UW going to Menards to buy? They still have them. You
Right.
know what I mean?
Yeah, they're working really, really hard. We keep getting so many emails like every like 20, 30
People,
minutes
right? Because
about
people ready to
updates.
make y'all them damn masks.
Yeah, I'm talking to people on my own, getting 3D mask printed and stuff like that. But they just sent us an email saying they're getting a really, really big shipment. So I think right here
Okay.
in Madison, things are better. I know they
Okay.
sent out that thing about people sewing masks and stuff, but the situation is not as dire right here in our hospitals. It's bad, but it's not as bad as some of the other cities and communities. And that's who I'm the
Yeah.
most worried about. So we're
Okay.
actually okay. They're on
Okay.
top of their
Good.
trying. Yeah.
Okay, that's good to know. Because I'm like, I'm about to go buy you some personally. I'm like,
Well,
oh no.
if you do
So,
have one of them, I will actually accept it
oh
so I
girl,
can have my.
I can probably give you about 20 of
Yes, I will take them. I'm not even kidding. I'll
them.
take
Yeah,
them because
I
right,
absolutely
you got the
20 minutes.
is the N95 ones.
Yep, you know it
Yeah,
is.
I'll take. We'll talk. We'll talk. I'm gonna get
Okay.
some.
And I'm like, girl, you know it is. You know, I had to do research. What kind of mask are we supposed to be getting
Right.
right now?
Yeah.
So is there services or support offered to doctors and nurses and CNAs? Um,
Mhm.
I mean, this is a lot. This is a lot of mental,
Yeah.
emotional stuff. So
Yeah.
what services do you guys have available to
Mhm.
you?
They have services where like you can call or it's like a phone line you could call
Mhm.
or text at 24/7 if you're having
Okay.
any issues. I think it's called Life Matters. And they can talk to you. So I
Okay.
tried them out once, but I fell asleep before I like texted them like, hey, I'm kind of stressed out. And then they wrote me back like 20 minutes later, but I fell asleep. Um, and they were like,
You
oh
had
my gosh, are you
look, you had
okay?
already cried yourself to sleep. Like,
I was tired, but I was like, let me just try this out in case I need it in the future. And
yeah.
then there's this thing called Headspace. It's this app where they have like breathing exercises and things, and they just gave free memberships for the whole year for any healthcare professional, where
Uh-huh.
it goes through like breathing exercises, and it's kind of like mindfulness, but not
Okay.
quite. But it's just like if you're stressed out, anxious, feeling burnt out, they just guide you through some
Oh,
breathing exercise,
good.
and that was really nice. And
Yeah.
then they just encourage us to keep doing the things that we tap into even before this that help. But what's
Yeah.
sad and hard is that even before coronavirus, healthcare providers, and I can speak particularly to physicians, before coronavirus already had one of the highest rates of suicide and divorce, depression,
Mm.
this field in general, which nobody really
Oh, wow.
talks about as much because when you're a doctor, you're supposed to be strong and,
Yeah. Have it together.
block that stuff
Yeah.
out. But
Hmm.
actually, this is horrible. There's plenty suicides in the healthcare field, one of the highest in any profession.
I
So
didn't
this
know that.
is
Yeah.
very, yeah. So then
Oh,
when you mix this together with it, it's
yeah.
very, very hard. And then another issue that's coming up, which maybe we could talk about it in a future session. But when everybody talks about we don't want to overwhelm the healthcare system, and this
Yeah.
is what's kind of been stressing me out, we don't want to overwhelm the healthcare system. Everybody throws around that term. And what that, for people, I know you guys, listeners, have probably heard it a bunch, but I'm going to keep talking about it over and over. Everybody says flatten the curve. We don't want to overwhelm the healthcare system. Well, I just want to
Yeah.
talk a little bit about, from my perspective, what that means. So
Hmm.
flatten the curve you'll see the pictures. It means that if we don't stop the rate at which coronavirus is spreading, where one person can infect up to 3 people every single day, then them 3 people infect more and more and more, we're going up at a very, very rapid rate, like very steep increase. And after you get past a certain point,
ain't no coming back.
Overwhelm the healthcare system. And what that means is that there's not enough beds to take care of people, or there's not enough ventilators. So let's just talk about that for a second. A ventilator is so what coronavirus does, the virus, when it gets into your system, it overtakes your body's own cells and it kind of hijacks them to start producing harmful things in your body. So it kind of like hijacks the system of each one of your cells. And then what it does is it attacks. The biggest thing that it attacks is the cells in your lungs and causes them to be destroyed. So when that happens, you can't get in enough oxygen in your body through your lungs. When you breathe in, you're breathing in oxygen, and then it's able to spread throughout your whole body. When your lung cells are destroyed, you cannot do that properly. And then you go into what we call respiratory failure, where basically your lungs aren't working anymore. And the solution for that is to get intubated or use a ventilator. And all that means is it's a tube that goes down your breathing pipe and it helps breathe for you. So there are a limited amount of ventilators, and this is what gets scary. So I'll ask you, Brandi. So if you were in our position as healthcare providers, and there are actually decisions in Wisconsin going on right now trying to get guidelines for this, if you were in our position, Brandi, and it's super busy, we've overwhelmed the healthcare system, you're working in an ICU, you have one ventilator left, one life-saving ventilator left, and I'm gonna tell you 4 different scenarios. You have 4 people that rush in. You have a 10-year-old Caucasian boy, you have a 22-year-old pregnant African-American woman who has had a history of drug use her whole life. You have a 55-year-old Latino pastor who's very prominent in the community. And then you have a 90-year-old veteran who is Caucasian, okay? And so all of them need that one ventilator. Who are you gonna choose?
Well, my response would be, it depends on who I am. So if I'm a white person, this is me and my my opinion and my analysis, I would probably choose the 10-year-old boy. If I was me and my personal self as I am right now, I would probably choose the pregnant woman.
Okay.
You know, and the sad part is that you even have to make that choice. And second, if there's no guidelines, even if there are guidelines, biases are going to seep in, because that's just how our brain works, right? It's just how it works.
So, yeah, so even the facts have to be in that position. And then, and what if you're that 90-year-old veteran, or that I said, that was your grandfather? You know, even though it's like, oh, the 10-year-old, the pregnant, but then what if you don't know them, but that 9-year-old was somebody that you love personally? So even the facts to have to like, and so what if you, Brandi, were tasked with the job of saying, okay, we're going to make some state guidelines to decide, to give guidance to all of these hospitals and decide what's the algorithm? What if you knew that 10-year-old boy had cancer and he was not expected to live anyway past 1 year? Would that change your decision? What if one of them was sicker than the other? How would you put all those things into play? The fact that you would even have to make that decision, and there's people having to think about that, that's very, very, very stressful and hard on the medical community. So it's stressful in the medical community, but also it's scary that we're even to that point. So that's when we say flatten the curve, don't overwhelm the healthcare system, is so that we don't have to make those decisions, which already some places are starting to have to make.
They are.
Right. And I can't say more about that because of confidentiality, but that's stuff like that and decisions like that and frameworks are already, the ball is moving for plans for Wisconsin.
Right. Right, you got to be prepared, right? You got to know it's the trajectory is what it is. So that means that you have to prepare you guys to make those decisions. And that's the thing that I don't think people are comprehending. It's like people are acting like this thing isn't real, right? They want to like share their theories and their conspiracies, or this is just the government way of trying to make us afraid. And I'm like, dude, people are real life dying. And then people asking in uninformed questions like, did you know someone who's personally infected? I'm like, I know at least 10 people on my
Yeah.
timeline that
Right.
got corona and they can't even get a test, right? And even if they did get a test,
Yeah.
what we do know is like you said, one person diagnosed or
Mhm.
applied or insinuated is that when one person gets diagnosed in a sense
Mhm.
positive, that means that they probably infected, for every one person there's probably 25 to 50 people, which means if
Yes.
we're saying in Madison there's 400 people, well, we got to times that by 25 to even get an
Yeah.
average look at how infected people are. And if we are at thousands, that means in 3 days we're going to be at triple that amount. Like
Yeah.
and I don't know
Yeah.
what else people need to hear. What is it that you think people need to hear to get it?
I think MJ, my little 11-year-old is playing tricks on me. Come here. Come here, say hi. Just look in the camera.
Hey,
Look how handsome he
MJ.
is. Look how handsome he is. He told me the other day, I was like, MJ, why are you in your room all the time playing video games? Come spend time with the family. He said, social distancing. And every time I try to give him a kiss, he's like, Mom, social distancing. I'm like, that don't count for me. I birthed you, boy. You can't social distance from your mama. So he barely ever comes down because he's like, I'm staying away from y'all.
He's
Nasty
like,
people.
he like, Mama,
I'm
you
not
go to
trying
the
to get no
hospital. I don't know.
coronavirus.
I ain't right. He's
Uh,
smart. He's smart. He's smart. He's
thank
gonna be
you,
a doctor too. He's smart.
MJ. Yeah.
Too funny. So
Okay, I'm
yeah, what are
sorry. He
some of
distracted. Uh-huh.
oh, okay.
Oh, you
So
said what do we need to tell people to make them get serious about it?
what do you think will make people believe it? Like what does it like girl, social media is so funny, but what
I think that if we start being real and raw about telling these stories of the people who are actually dying, that might help people to understand, because until it really hits close to home, there's going to be the theories of like, who actually is anybody getting it, what's happening. So I think continuing to tell stories, it's starting to even hit me hard when I see the pictures of the people dying in Milwaukee, because that's where my hometown, where I'm from. So when I see Black and brown faces of people that are actually like young, not even that old, when I'm seeing that,
yeah.
it's like, ooh, that hit close. And so I think, because on the other hand, we don't want to incite fear,
Right.
but that's something that I think we have to have the fine balance and maybe tip it a little bit more toward actually being real and telling some of these stories. But what's difficult is that as the medical field, because we have to keep confidentiality, we can't go out and scream to the rooftop like, oh my gosh, guess what I saw. So it has to really be the families that tell some of these raw stories. For example, I'm always in a weird spot. I do a lot of work with infant mortality and preventing babies dying before the age of 1. Because right here in Madison, we have racial inequities in that. So I sit on different committees that actually review all the cases of babies who died before they reached age 1. So when I'm reading through some of these graphic details and what happened, when I see patients who are not taking things seriously, I want to be like, oh my gosh, did you just hear this story of this, and that? But we can't, we have to protect confidentiality. So we can't do that. But I think if people really heard some of these stories, heartbreaking stories of people dying, including younger people with no underlying health issues and having to die alone, because you can't have any guests when you go to the hospital for this, dying alone. And I think that maybe that is something that we can do to help. That's all I can say, other than just telling people wash their hands. They need to hear these stories.
I think you're right, because people they don't think it's real for them. And that's the thing about our world, this society that we live in. If something doesn't impact us directly or some way around us where we can see it and witness it or experience it, then somehow in our mind, maybe it's just the way our mind operates to deal with all the data we receive every day. But somehow, if it's not happening to me, then it's not really happening, right? Like, it's like, racism isn't real, sexism isn't real. Y'all just sensitive. You just
And then I think that you have to know too that everybody is different in the way that they learn. So they're just like every kid, you have to treat differently.
Yeah.
Fear doesn't work for everybody.
Mhm.
I always love watching Scared Straight, where they would take the kids
Oh
and they
yeah,
would take them
I
to
didn't
the
like
jails
watching
and
that.
scare 'em.
That shit make me mad.
Yeah, so some kids responded to that, right?
Yeah,
But there were
yeah,
some kids that it just made them harder. So my thing that I just said, we need to tell people dying, that would
yeah.
work for a subset of people where that
Right.
tactic works. But then some people that won't work, and you need to appeal more to their emotions, saying,
Mm,
don't do this out of fear for your own life. Please, can you do it to save someone else? Some people respond more to that, where they feel like, okay,
mm,
I'm helping someone, versus fear. But
right.
I think it's a combination of all that, depending
Yeah,
on each individual person. So,
yeah, yeah. And what can we do? Like, what is your thoughts around what we should be doing
mm,
um to live that reality right now? How do we take care of other people in our world? What are some things that we ought to be doing?
yeah, well, it's a lot, because it is ways that we can take care of people physically, as far as
Mhm.
preventing the spread of coronavirus. But as you know, as a side effect of that, our economy has taken a huge hit. So there's ways
Yeah.
to help in that way. But then as a result of both of those things, people's mental health has taken such a huge hit. And then even the significant increase in child abuse cases that we're seeing, because of the mental health going on with the caregivers and things like that. So there's many different fronts, but I'll hit on the first
Mhm.
one, for our physical health. How can we flatten the curve? How can we stop this? It's very, very simple. Staying, I don't even curse, but staying the F home. That's the hashtag. I don't curse, but this is making me want to curse. I might put that hashtag on. Stay the F home. but but that's really, really serious, because you could have it on your hands. You can have it can even be in your hair. We're seeing it could be on your skin, it could be on your clothes. When you go any place, you have the risk of, if you have it, you're transferring it to someone else, but also you take the risk of getting it yourself. So just staying home as much as possible, limiting anywhere you go, anytime you step out the house, just limiting that. That's number one. The other thing is, like everybody says, good hand washing. And what good hand washing means is, like you heard of, 20 seconds with soap and water. And make sure, if you have rings or jewelry on, you really take those actually off and scrub your hands front,
Mhm.
back. And actually, we in the hospital, everybody talks about just scrub your hands, but actually scrub up to your elbows, where
That's
you're
what I teach
washing.
Messiah. That's what I teach
Yeah, you
Messiah.
scrub up to your elbows. Some people also say, and what we're doing, a lot of healthcare providers, when we come home from the hospital, we're taking off our clothes before we even enter the house, taking off our shoes,
Mhm.
because there's studies that show coronavirus could be on the soles of your shoes. So we take that off.
Mm.
We go take a shower. A lot of us take a shower first before we even start talking or interacting with people. So that's something
Mm.
that you could consider doing. So
Mm.
good hand washing. And then another thing too is, if you do feel a sneeze or a cough coming, going in your elbow, coughing like that, and then take them clothes off and go wash them as
Yeah.
well. Help other people out if you are able-bodied and you can, even though I said don't leave the house, but if you know that there are other people who don't have transportation or that have higher risk conditions, volunteer to go pick them up their groceries and drop it off for them. Do something to
Mhm.
help other people. um,
Mhm.
Balance that with staying in and protecting your own self, but do what you can to help other people as well. So those are some of the things I would say from a physical standpoint. Another thing too, I guess I'm not done, I'm gonna keep going,
That's okay.
is just do whatever other things you would do to take care of your health and wellness in your body. Because when you're stressed out, when you're extremely sleep deprived, not eating right, you can lower your own immune system, and you don't want to make yourself at risk, higher risk for getting infected with coronavirus. So
Mhm.
whatever you need to do to just continue to take care of your own self
Yeah.
is really important as well. So that's what I would say on the physical front. Any
Yeah.
questions on that, or thoughts?
No, I think that was some good advice, because some of that stuff I didn't even think about. And what would you recommend for Black people? Because you saying it gets in our hair, and we're a little funny about washing our hair. And like me, I got these darn crochets in.
Yes,
Like, can
yes.
we spray ourselves with disinfectant? A little
Well,
peroxide?
so what I'm doing at work, even though everybody else, it's not right now, when we work in the hospital right now, we have to wear a mask. and then we wear a face mask and then face shields. But it's
Okay.
not mandated that we put anything on our hair. But me, I have dreads. And I don't wash my hair every single day.
Okay.
So I wear, just for me personally, I wear a cap over my hair when I go to the
Okay.
hospital, not when I
That
go
makes sense.
everywhere. Yeah, so that's
Yeah.
how I do it. And so that's a personal decision of if you want to wash your hair every day. I know not to come on, and I don't want to mess anybody's hair routine up, but
It
whatever.
is what it
If
is.
you were every once a month hair washer, maybe do it twice a month. I don't know. It's
Right,
just
right, right.
it's a personal decision. So,
Yeah.
but anything you can do to minimize your risk, then that's what you have to do.
Yeah, amen. So does peroxide kill viruses or no?
Well, there are, I have to go look at it, but there are actually guidelines. I think it's on the CDC website where it lists a whole bunch of different ingredients, and then it
Okay.
will tell you which things have been shown to kill it. I believe they're saying, like, as even when you get hand sanitizer, making sure it's like 60% alcohol and things like that.
Alcohol.
I don't have that memorized, but if you
Okay.
go to the CDC website, they do kind of list out specific ingredients. So I
Okay.
don't want to comment on that because it's not just the ingredient, it is what percentage and how strong
Uh,
that ingredient
okay.
is. So there's some, hand sanitizers where it might be only 20% alcohol, and that's not effective. They want it to be, I believe the last that I saw, at least 60% or higher. So I don't want to comment on that because I don't want
Yeah.
to say anything wrong, but go to the CDC website, and it's good to like
Yeah.
check out your products and make sure they do.
Yeah, that you're good. I know I read about this distiller making, they're not able to make hand sanitizer because of some kind of rule or policy. But what
Mhm.
they decided to do is create 140 proof vodka. So it's 140 proof alcohol. They're saying that people can just mix it with some olive oil or use it if they need
Mhm.
to kill the virus on their hand.
Yeah, I would just check on the CDC website.
Right.
But be careful too. Be very, very careful. Anybody who's out there trying to make your own and mixing, because you can have very horrible combinations that make toxic fumes that you
Oh,
could die from that. Just trying to be at
well,
home
damn.
mixing shit,
Right.
all kind. You do have to be careful. There was some literature out there that was saying there's a toxic combination of certain, because people were starting to wash like mix different home cleaners with bleach, and
Mm.
sometimes just like chemistry, when two certain
Like ammonia and bleach. We learned that earlier.
exactly, yeah, so they were creating toxic fumes that'll take you out. So just be careful. Just be careful with that.
Yeah. And what do you recommend in terms of caring for children? A lot of kids are at home now. Like, what,
Yeah.
Lord? And like you said, doctors are experiencing mental wellness. Parents
Hmm.
are experiencing mental wellness challenges, increase in child abuse with
Hmm.
children, increase in domestic abuse is happening. It's
Yeah.
just, it's like
Hmm.
all out hysteria. But it's quiet, it's eerily quiet outside. You know what I mean? Like, what's happening? It's crazy. But anyway,
Yeah.
back to the point. I digress. What
No.
would you recommend as it relates to
Mhm.
caring for children at home and routines that we should get into with our children?
Yes. Yes. Thank you for asking that question. It's so important. There's many different things, but I'll tell you like a couple of the things that I'm trying to practice in my own family and I'm recommending to everybody. Number one thing is to make sure to do daily, or some kids need twice daily check-ins with your children, or even if it's not your children, the people that you care, the young people that you care for in your life. And in our house, I call it coronavirus check-in, and they know what that means. It just means, how are you doing emotionally with all of this? Are you washing your hands? Are you mentally okay? Do you have any questions for me? And I'll individually in private check in with each of my kids about how they're doing with it. And so, for example, my son, as he was processing all this, he wanted to know how many cases of coronavirus are in Wisconsin. And then I looked it up and I told him, and he was like, how many people are in Wisconsin total? I was like, oh, that's smart. So we looked up the population of Wisconsin, and then he wanted to divide how many coronavirus cases there are by the population of Wisconsin. And he saw like that's not, even though it's all over the news, that's not even 1% of the population. Like, that makes me feel a little bit better. That was his way of processing through it, where my daughter is not into math or care about that. She's asking about, like, am I going to die from it? Because that's the question on a lot of kids' minds. Like, if I get it, I'm going to die. What does this mean for my family? So I kind of explained and talked about it to her. Also, a lot of kids hear that their parents have lost jobs or are stressed out economically. So my son, he was worried about that. So I explained to him, you know, there are a lot of people who are hurting from this economically, but I told him, just know, mommy and daddy, we've been talking about it. You know, you're going to still have a place to stay. We're okay. Our bills, the money's okay. So don't worry about that. So it's little things that kids pick up on that they might be worried about just because they hear you guys talking about money or something. They might just get super stressed out. So just having frank, honest conversations. So I would say that's one of the biggest things. Check-ins, whatever that might mean. Asking them how they're doing. And then the second thing I would say is children really, really, really need routines and a schedule. Now, I am horrible, even though everybody's like, Dr. Jazz, you're so organized and you're doing so much. My secret is I'm the most unorganized. I'm the most unorganized person ever. I'm not.
I just knew you were organized too. I said, this girl's a beast.
No, I'm extremely motivated, and I know I'm the master at multitasking. And I'm motivated, I'll get it done, and I have confidence. Like, if I see an obstacle, we're gonna do it. But I'm not organized. So like, if somebody comes in my car, you'd be like, oh my gosh. And I'm just not an organized person. Not that organized, like as far as structure, where people have lists and color coded. I don't. I'm not. That's not my thing. I recognize that, and I'm working on it. So I have to like go above and beyond just to like make a basic task list or schedule for my day. So anyway, but kids really, 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 really need that structure, because if you think about it, all kids were in school, and at school is something consistent and constant. They have a strict schedule of what days they go to gym or arts or whatever, when they do what. And even when they come home, if the home environment is not very structured, at least that's one thing in their life that was constant. They had the same teacher every day. They had the same routine. Now, all of a sudden, we've completely pulled the rug out and removed that from them. It's already scary being in coronavirus season, but when you come home, there's no structure. So one of the biggest things for kids, just to add a sense of normalcy in their life and something that they could depend on, is make some type of schedule. So even if it's not super detailed, like from 9 o'clock to 10 o'clock, we're going to do this, from 10 to 11. If you're like me, that you just can't get that, you can't do all that. I tried, we'll write it out, but then enforcing it is another thing. Even if it's something like one thing that they can look forward to in each day, like, okay guys, Monday is going to be family pillow fight night, Tuesday is going to be this, something that they can see, so that they can feel like even in a world that's falling apart around them, they have one thing that they can hold on to. That is really, really important. So just giving them some type of structure. So that's one thing. Having the check-ins, giving them structure. And then another thing is the power of exercise and laughter. Exercise and laughter. So I would say have them go outside and just do some jumping jacks or run around. Even if they don't have a bike or anything, there's nothing stopping them, unless they have disability, or I don't like the word disabilities, but if they have physical restrictions that don't allow them to do that, they're still just within whatever their ability level is, get them moving. Even if they're in a wheelchair, moving their arms up and down or whatever, get them moving and get them laughing. Because one of the most amazing things about movement and laughter, even when you smile, there's a release of something called endorphins, and those are the chemicals in the body that cause happiness, that relieve stress and anxiety, and even lessen pain. So Brandi, I've seen plenty of pictures of you working out, and you're my inspiration. Like, yes, she's all working out in the morning. I'm like, oh man, I need to go get my workout in. After you work out and you just lay there, how do you feel?
I feel euphoric almost. Like, I did that, especially if it was hard. Like, it's like you feel your body is relaxed, you're relaxed. And that's why I like to exercise early in the morning as soon as I wake up, because that sets my day. And when I don't exercise, life is different. Life is different.
Right.
It's almost like a drug. It's totally different.
It is.
Um,
Yes.
and it's hard to like do it if you're not. It's only hard to do it when we overthink it, right? Like,
Right.
so it took me about a week. We've been in quarantine for almost 10 days now. And it took me probably the 10 days, maybe 8 days to get my kids on a routine, right? Because
Yeah.
a part of me was feeling full of anxiety. A part of me I didn't know what I was going to do with these darn kids being home. And I'm just like, this is just too much, right? Like, so I needed
Right.
time to be okay with what that felt like, right? So don't
Yeah.
feel like you got to be perfect and you got to have this thing figured out.
Right.
And finally, yesterday we met, we talked about, how are we going to live this reality, right? So
Yeah.
I decided that every morning they get up at 7 and they hate me for it. But I feel like the earlier we get up and start our day, you know what I mean, the better you'll feel later. Like when you get ready to lay down, you go, oh, I'm glad to lay down versus being like, oh, I'm bored.
Yeah.
I've been in this bed all day,
Yeah.
and it's working.
That's
They've
good.
been exercising with me. They're mad about it, but they'll be fine. And
But
they
they'll be
seem to
fine.
be, yeah. And they do better afterwards, right? They complain,
Good.
I didn't want to, oh, my leg hurt, but then
Yes.
afterwards they're like, oh, that was good,
Yeah,
so.
exactly. And that euphoria that you talked about when you say it's like a drug, it literally, why it feels like that is because of those endorphins. There's
Yeah.
actual chemicals being released and going to act on your brain that help with pain, stress, anxiety, give you that high. So that's just something that you can tap into, physical activity. Even if you don't want to do it, just like force yourself to like start walking or doing something. So physical activity and laughter does that same thing. That it does. So watch a movie, a funny movie, or have a joke contest or a staring contest, or like try to make each other laugh or something like that. So something that's funny like that. And those would be some of the main things. There's plenty other things. And I actually did a post on my Facebook page where I listed like 10 different things that you can do to support your kids' social and emotional health.
Oh, okay.
And I'm on a co-host on a radio show called the Madtown Mom Squad on 93.1 on 93.1 Jams. And there's a podcast that we made from that episode. So I'll try to send it to you to share it. And we talked about like some of those things. But those are three of the main ones: exercise, check-ins, and then joy and laughter and some type of schedule.
Yeah, and those routines aren't just good for the kids. They help us mentally, right? Because we also are pushing ourselves to stay engaged and self-care. And I promise you, my kids get on my nerves, you know what I mean? And when I'm in their presence, like if I go in their room and sit down and talk to them for a few minutes and like you said, check in, I usually end up laughing or talking crap with them, so then I end up feeling better. So it's part of like one of those things we have to practice pushing our way through. Like if we find that we're feeling a little depressed or out of it or just exhausted from everything, mentally, emotionally, and or physically, is that in those moments, I'm just going to encourage people to push past that moment. Make yourself get out the bed, you know what I mean? And be like, it's just this moment. I just need to get through this moment and up those 5 stairs and it'll be fine, and then it'll be over with. And then you can go back to bed if you like.
No, can you hear me still? Oh, okay.
Yeah, I can hear you now. Yeah.
For people to have alone time. So if our family is all by each other, all 5 of us, every single second, 24-hour day,
oh my God,
it's just all bad. Even the baby get an attitude. We have to have time. We're together, which is great, but then just knowing like, okay, everybody go it's okay to have alone time where you can just be alone for yourself and just balance that. Another thing I want to say too is, and you hit on it, we as caregivers need to understand that sometimes kids don't understand like rationally everything that might be going on with the finances or understand the pathophysiology of coronavirus, but what they do remember, and they're going to feel our energy, how we're responding. And you set the tone for your family. So even I had to check my own self today because I was really mad because the dog peed when I woke up, like peed on the carpet. I was just already upset. And then that just took me over the edge this morning. So I was yelling, somebody go come pick it up. I'm so mad. This dog pissed off my dog. Right. Yeah. And but that's how I woke everybody up. I was just mad. Like, we got coronavirus, dog. Don't you know I'm out here trying to save lives? You want to come down here and pee in my relaxation room? Have the nerve to knock me on the You didn't even buy. I was just so, I was so mad. And but that set the stage of how I woke everybody up. Then it made everybody grumpy or mad. They got to clean it up. It just set a domino effect. So then we had to kind of, you know, that wasted the first 30 minutes of the morning where everybody angry and mad.
Yeah.
And so then it took a while to like get us back on track. So all that I'm saying is you just have to be mindful that you're setting the tone in the house. And take care before you can take care of your kids. Before you even wake them up, wake up an hour early to just calm your own self down. And then know if you need help, there, reach out. If you feel like you can't handle it on your own, there are lots of mental health professionals that you could talk to if you need to, before you take it out on the kids. You hurt yourself or you hurt them, because let's be honest, it's a lot more spanking going on, a lot more punishments going on, because some issues that you might not have had to deal with before, your own mental health stuff, when you're cooped up in the house, it's very, very triggering. You don't have a lot of these things. So now is the time to, like, that's one of the positive things about being in a home. It's the time to like get yourself together. And even after coronavirus, you can keep some of those same routines. But a lot of stuff is manifesting that was hidden under the rug is coming to manifest. So it's time to do it.
Because you can leave your kids, run off and do A, B, and C, and now you got to be at home with them. No more distractions. And that's the thing too, is like, there's some positive in it that is forcing us to see ourselves and how we interact. I think that's very positive. Like around being self-aware, right? And like you said, it's just a little mindfulness. Does that mean that you're going to be perfect? No. Like you said, you went off this morning. You got up and you was like, damn, dog pissed on the floor, right? And yesterday you
on the carpet. The carpet. It wasn't just the wood floor where I could just wipe it up. The carpet.
Right, exactly. Now I smell this piss. Don't you smell the piss? Everybody get up. You know, and when you do have the moments, you know, acknowledging them, you know, and having a conversation with your kids. When I go off on my kids, because I do, you know, I'm a human. I like to talk to them about it, right? I want to acknowledge what my part in it and what I'm working to become as a parent. Like, I'm not perfect, and I've been a parent for 26 years. Let's just say that 26 years.
And looking good. I'll say,
no,
and looking good. I said, and you're looking good. I want to be a grandma looking like you.
Right. So. Yes. And I'm still trying to navigate it, right? Being a parent and being mindful and self-aware. So just be encouraged that you don't need to be perfect in this time of stress for your children to be okay. You don't, you just have to be real and authentic with your children and be intentional about, you know, not setting the tone for the day in a negative way. Like you said, taking some time in the morning. I wake up way before everybody. I do. I'm up and I'm like you said, I got my little routine because I know I got problems, right? I got anxiety. I come from a whole generations upon generation of unhealthy people. So in knowing that, I know that I've picked up some unhealthy just responses. So I just practice being intentional, and the more you practice it, the less you do it, you know, and that's all life is really about, as far as I'm concerned.
And when you make mistakes too, let that be a learn, because like you said, every parent is not perfect. Let that be a teaching moment for your own children, and say, hey, I'm sorry I was yelling in the morning. But this is what I did to help me through that situation. What did mommy do wrong? Or you talk through that and then come up with solutions together. Like, kids, how can we prevent the dog from peeing on the carpet next time? Like, should we get a schedule and mark down who's the last person that took him out or something? I'm sorry I did that, but mommy's just a little bit stressed, and here's what I'm doing. So then they see not that you always act perfectly, but they can see even when you make mistakes in your weakness, how you're getting through them. So it can still be a win-win situation, a learning.
Integrity. Get your integrity back intact. It's so true. So all of this is really based, you know, framed around the conversation of Corona and all the stresses that's being multiplied and compounded right now on families. And I wanted to talk before we let you go, because I don't know how long we've been talking, but probably for a while.
I'm good. I'm good for right now.
Okay. I want to check in with you about when should people come to the hospital, right? Because there's also this influx of people running to the hospital as soon as their nose run. And then there's people at home dealing with like real life bad symptoms and aren't seeking help because they're afraid to go to the hospital, or they're feeling like, oh, there's no test. I don't want to overwhelm it. It's probably just a flu. I'll be fine. Like, so when do we know?
Good question. So I would say the best thing to do if you are in doubt is actually not even if you're in doubt, no matter what, the best thing to do is call your healthcare provider, your primary care doctor, what we call it. But everybody says that, but the reality is some people don't even have insurance, or some people have insurance, but they've never been to their primary doctor in 10 years. Yeah. So that's the first thing, like try to find out what is the clinic that is like your home-based clinic, the place that you go get your flu shot every year, or the place that if you had an issue, you would normally go. Even if you aren't connected, call that office first, because they have nurses and doctors that would talk to you. And all you do is say exactly like, your age, the stuff that you're going through, if your nose is running, if you have a temperature, you just tell them the situation, and then they are going to triage you, and which means basically just tell you what to do next. They might say, we're going to set up a video visit with you because we want to actually see your breathing. They might say, actually come into urgent care in person right now. Or they might say, go straight to the ED, or they might say, call 911 right now. They'll guide you through that. So I would say for anybody just wondering, like if you're concerned or wondering about your health, you call first, because that helps two people. It helps you because it helps you to get understanding about what's going on and know where to go, but it also helps protect the healthcare providers that are at that clinic or hospital. Because if you come saying, I have a fever, I'm coughing, I can't breathe, and you might have coronavirus, they'll prepare for you coming, and they can put extra precautions up so that they can get prepared before you just arrive. Right. So that's what I would say. In general, we're telling people, though, I'll give you a sneak peek of like in general what they're saying, but this is not official medical advice. So call your actual medical provider. But in general, what they're doing is that if people are suspected of having it, sometimes they'll offer like drive up testing, and there's actually starting to be in-home testing available. It's not readily available right now, but that's kind of what people are moving toward. But in general, they're saying just to stay in the house, because about 80% of people who get coronavirus, which is caused by, the actual virus is called SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. So that's the actual name of the virus. But about 80% of people who get it, it's just going to feel like a mild upper respiratory illness that they will recover from. It's about 20% of people who actually have to go into the hospital, or a smaller minority of that actually get critically ill. So let's say you do get it. Most people, your own immune system puts up a fight against it, and you can stay at home. You might experience some coughing, you might experience runny nose, a little shortness of breath. But if it gets to the point where you feel like you can't even walk across the room, up the stairs, you're starting to get a little more dizzy, or like not as alert as possible, blue discoloration around the lips, where like even the stuff you're doing at home, you feel like you really can't breathe, then that's for sure when they're having people actually come in to get oxygen or those higher level things. But if it just feels like you have a cold, no, you most likely can just stay at home. So that's kind of the tipping point. But the biggest thing to remember is that's not specific medical advice for an individual. You have to call your actual doctor, because they know all the other things you're going through. Like if you have asthma, they might have a lower threshold to bring you in, or, different things like that. So call the doctor, call the healthcare, and they will individually tailor the decision to you.
Yeah, and if you don't have a doctor or primary, you just haven't ever been to the doctor, you can just pick a clinic and call them and say, I'm looking for a primary doctor, right? And then they'll refer you to a doctor, and then you can kind of pre-register for it, like, hey, I just want to make sure I have a clinic to call just in case, blah, blah, blah. That's a suggestion I would make.
Yep, or you could call the emergency room too. You don't want, we're trying not to send everybody to call the emergency room, but when in doubt, if you say, I was thinking of coming in the emergency room, but before I come in, I just want to talk to somebody, they will be happy to try to get you from coming in if they can have somebody talk to you. So yeah,
Yeah.
that's what you do.
Okay, that's some good advice. So, any closing remarks, anything you want to share that we didn't think about? I know we talked about a little bit about the kids going outside and playing. You was like, let them ride their bike, let them run a little bit. So the idea of social distance is just so that we're clear, because it's just this word people created, and I don't think people
Yeah,
really understand it. Because I see
yeah,
people. There was an article yesterday from Milwaukee where people were outside walking, right,
yeah,
and they were like so far away, and I'm like, well, they are 6 feet, you know what I'm saying? But
yeah,
still, if this thing that we're saying, this virus, is airborne or can be airborne for 3 hours, then if someone's walking 6 feet in front of me and they cough and I'm walking behind them, I
yeah.
mean, there's a possibility. So, what is your suggestions in terms of being outside, taking walks, protecting yourself?
Yes, good question. So there's still a lot of studies about that, how coronavirus, how it can spread. And as you mentioned, there's some studies that show it can stay airborne for 3 hours, but it's way deeper than that. When those particles get in the air,
Uh-huh.
they start to like drop down to the ground. It depends on how big of a space you're in, how fast they disperse. So for example, like if you're outside and there's so many molecules and it's a big wide open space, it's less likely that that's going to be able to get to you compared of if you're in a little bathroom with somebody and they cough, it's like not that much ventilation for it to kind
Right.
of get dispersed. So that's why being outside is not as scary.
Okay.
But you're right though, we don't know. There's a lot of research into it, so we don't know. But sometimes you have to weigh the pros, weigh the risks and the benefits. So the
Okay.
risk of staying locked up in the house and not protecting your mental health, if you want to go out for a walk, I feel like the risk of going crazy in the house, abusing your kids, is more higher of a risk than to just go walk outside and you
Taking a
might not
walk.
even run
Right.
into anybody. Yes, there's a
Right.
very, very small risk. You might get it from being outside, but in general, that risk is very, very low. Especially if you stay away from people, you need that to keep your mental health up so you can come in the house and stay sane.
Yeah.
So I still personally recommend getting outside if you can. Now, I would say don't go to the park, have the kids going to the park,
Right.
climbing up
Right.
and touching on
Yeah.
everything, playing with their friends, playing five or touching on them and stuff like that. If it's a walk and you stay away from people or just let the kid play individually, that's fine. If you yourself go take a run or something, that's okay. But just still try to practice social distancing. But I still agree with getting outside.
Yeah, me too. Me and Messiah have been going outside riding his bike. And then to be honest, if you take a walk or you're outside your house or apartment complex, there's usually not a ton of people walking outside. It's like you said, when you go to the park or try to walk around a lake
Yeah.
or take the trip down the lakefront or something, if you're in Chicago, but here is John Nolan, that's where you might run into 7 people at the same time trying to cross this little bridge or something.
Mhm.
Um, so yeah. What else was I going to say? So out of this, in closing, since we always want to add some positivity in this
Yes.
somehow,
Yes.
because there really is always some beauty and
Yes.
light in dark.
Yes.
Always, one can't
Yes.
exist without the
Always.
other. So, what are some positive things that you're seeing in the community, in
Yes.
families, just in general? Like, what's standing out
Yes.
to you?
What I'm seeing positive is what we talked about with the families, all of those
Yeah,
routines and things we talked about, those are things that I being honest, like I should have been had them in place,
me
but I
too.
was
Me
just
too.
so busy going places. It's like all of these routines and family pillow
Yeah,
fight nights, all of that stuff, we did it, but it's amplified because of the quarantine. But just, I think after this is over, life is never going to 100% go back to the way it is. I believe there's going to be families that say, hey, I actually like homeschooling, or let's keep some of these routines, or, oh, we're going to keep going on family walks. I think
yeah,
people are, or maybe it's okay not to be busy and running around to all these social events and like, man, I miss staying home with my family. So I think
yeah.
that's going to be some beauty of it for some people. And then also another thing that's beautiful about it, I love just seeing people helping each other and coming together. I
Yeah.
saw some, like, I think it was from Cuba. It was some Cuban doctors getting off the
Yeah, they
planes.
went
They
to
went over to
Italy. Yeah.
Italy. And so like just stuff like that makes my heart warm. We're having people say, we'll sew you all masks. That's so helpful. And then I'm in one group of some women that were praying for me, and they knew I had to go to work over the weekend to cover somebody. And they said every couple hours they were taking shifts to pray for me. So I was literally at work. There was somebody praying for me every single hour for my protection. And I was like, man, that's powerful. Just to know that, just to see the good heart in people, that's something good coming out of it. And then another good thing is that with all of this time in the home, I encourage people, channel all your pent up energy into something productive. Write your book, write that book.
I know, I need to write that dang book.
Yes.
Oh my God.
Start your course, develop a business, like while you are here, take advantage of that time so that after, things go back to life as normal, you've created something new. You wrote a business plan, you did something great for your future.
Amen. I think that's it.
Come out of it.
Yeah, I think that's it. That's great advice. Because instead of and it's always like, is the glass half full or is it half empty? I mean, we know that in this world that we've been pressured to hold 3 jobs, take care of our kids, do this, go to school. And now we're being forced to do something different. And as a matter of fact, a couple of weeks before this happened, I was on Facebook talking mad crap, like, look, Black people, you know me. I'm like, we just need to pull our kids out of public education and homeschool. We gotta to save them. And some folks like, that's just not reasonable, right? It's just not something we can do. People can't homeschool, right? They don't. That's a privilege, and I agree. Generally speaking, homeschooling is a privilege. And my response to that is that we have to figure out how to make this thing happen, because our kids are being destroyed. Now, the crazy part now is that we're forced to be home and people are forced to homeschool. And like you said, I'm hoping and praying that the positive will be like, people will figure out that they can do it. And it's better for their mental health and their children's. And that's my political view. Only, of course, right? Because that's just who I am. But, all of that is.
It might be it's not right for everybody. But it's right for some people who were just maybe scared to do it. I believe out of this is going to be a couple people that decide that's what's right for them. So
and I'm going to celebrate those people. I'm going to celebrate. I always got a political agenda. I'm going to celebrate.
It's always something good. And I think perspective is very, very important in this. For everything you could say, you could always think of somebody who has it worse or a worse situation. Like, I'm sick of being stuck in the house. Well, at least you have a house to be stuck in. And then even for people that don't have a home, I'm homeless. But even the fact that you can think that thought in your head to say, I'm homeless, that means you're alive. That means you're breathing. Where there's plenty of people who didn't wake up this morning. And I know that's cliche, but when I, especially going through my medical training, have seen so much death, it just gives me a different lens when people complain about things, where it's like, well, at least you can open your mouth to complain about it. That person, that little kid just had a stroke and they're never going to be able to talk or move again. Like, at least you could formulate that thought. At least you're alive. Not downplaying anybody's situation, but no matter what, I always try to just look at it in a different lens.
There's an and, right? Not to downplay, you're homeless and you still got your mental capacity to figure things out. You can figure this out. Let me pick up the phone and call somebody. And like you said, people get in car accidents and they become vegetables, right? Quadriplegic or what have you. And as long as you got breath in your body, you're going to be all right. You know what I'm saying? That's how I think you're going to be all right. We're going to be all right. We're going to be all right.
Out of ashes comes beauty. There's going to be beautiful things that come out of this. And we just got to all stick together and talk about it. Don't try to be too strong. If you feel like you're getting weak or you're having a moment, call up somebody, talk to somebody, and just know that we're all in this together. Even the strongest people definitely have their moments of weakness. I know I do, but we just have to stick together and support one another, and we're going to get through it.
Amen. That is right. Amen. Well, thank you for joining us today. We so appreciate your time. We know you're busy, and you need to be relaxing because we don't know what Monday brings, okay? And I'm going to get you those masks, and I'm going to send Eric. I'm not going to go outside, but I'm going to send Eric to Menards to see how many we can buy, and then I'll connect with you and get them to you. Yeah.
Okay.
And how can people follow you? If someone's watching this that's not familiar, how do they follow you?
Yes, they can follow me. All my social media is at Dr. Jasmine Zapata. I'm on Twitter, Facebook, Instagram. I even have a Snapchat, but I gotta be more active on that.
Right.
And my website is www.drjasminezapata, Dr. Jasmine Zapata. So that's all my social media, but I would love to have people follow me. And I try to share information and news articles that I trust, and because that's something, there's all kind of news out there, but I try to share things that I trust and positivity. And then also one of my things that I do on the side, as you know, I'm an author, but I'm actually helping a lot of people, other people write their books. So if that is something that you are trying to do, I help people write books that help heal, uplift, and inspire. So I don't, my publishing company doesn't just do any random books. It has to be something that's empowering, that helps people heal, uplift, and inspire, like emotional wellness or some self-help books, something positive, then I can help with that. So hit me up if that's the question, or if you have any other questions, I'm happy to help. Or even if I can't do it, I could try to connect people with the right person who might be able to help.
Amen. And she will respond. I can guarantee you that. She ain't one of those. She ain't one of them doctors. She will respond. Thank you, Jasmine. We love Dr. Jasmine Zapata. We absolutely love you and appreciate you. And I'll reach out about the other stuff.
Okay. I love you too. Anytime. Anytime.
Okay, baby. Talk to you soon.